Good afternoon. Thank you for joining us for this uh, virtual town hall meeting for faculty and staff. It's been an incredible year. The spring semester is winding down, and we're looking forward to next Friday and Saturday when we hold in-person graduation celebrations to honor our spring graduates. This semester has been another monumental team effort from every corner of campus. I am deeply proud and grateful for every member of our ISU community for your resiliency, your adaptability, and your commitment to serve our mission, support our students, and maintain our campus operations. 14 months ago, COVID transformed our lives nearly overnight. For many faculty and staff, that included a sudden shift to remote work that was intended to be temporary. For others, such as our frontline staff, they have been working on campus throughout the pandemic with mitigation measures in place. The ISU community has done an extraordinary job of adapting to the changes and overcoming the challenges of the past year. It was a big change when we made the abrupt shift to remote work last spring, and we know it will be a big change returning to campus this summer. We're excited, though, to have our campus bustling once again and to provide the vibrant in-person experience that Iowa State University is known for. We encourage supervisors and employees to have conversations now about plans for returning to campus workspaces. A frequently asked question, an FAQ, has been shared with supervisors and has been added to the COVID-19 updates and resources page for all employees to access. The link was also shared in this morning's Inside Iowa State. The FAQ provides more information to specific questions about returning to campus workspaces. It's important to note that our ISU Workflex program is still an important priority for the university. The Workflex program is in development and includes more than just remote or hybrid work options. It will be a comprehensive program that considers many options for flexible work arrangements for staff. Once employees return to campus and the Workflex program is finalized in October, careful planning and conversations can occur for implementing this program in departments and units. The Moving Forward Coordinating Committee is working closely with the working groups on a number of topics for returning to campus. More information about issues such as ventilation, cleaning protocols, office space, and capacity will be shared in early June. These teams are also considering our cyclones care mitigation measures for summer and fall. We'll be sharing more information soon about how we transition some mitigation measures even this summer. Final decisions for fall will be shared closer to August. One of the most important steps for returning to pre-pandemic campus activity is vaccinations. We are thankful that the COVID vaccines are now widely available, including here on campus. I want to recognize and thank our Teelan Student Health Center and our public health team, our emergency operations team, our College of Veterinary Medicine professionals and students, and the hundreds of faculty and staff volunteers who are making our large-scale campus vaccination clinics a big success. Thank you, everyone. Today's Inside Iowa State features some wonderful testimonies from individuals who have volunteered at the clinic. I want to share the following thoughts from Fred Lloyd, Assistant Director for the Veterans Center. After his shift at the clinic, Fred said he was physically tired, but emotionally felt great. He said, quote, "It was the first time since the pandemic started that I felt like I was directly helping to do something to end it. It was very rewarding." Well, what a great feeling. Thanks, Fred, and thanks to everyone for doing your part to help us get to the other side of the pandemic. We have two presenters joining us today to talk about vaccinations. Aaron Baldwin, Associate Vice President for Student Health and Wellness and Director of the Teelan Student Health Center, and Dr. Dan Fulton, Infectious Disease Specialist with McFarland Clinic. We also have a number of campus leaders joining us to help answer your questions later in the program. Please note that you can type your questions in the Q&A box at any time. If we aren't able to get to your question, you may submit it to the covid-19@iastate.edu email address, and we'll work to get you a timely answer. Now, I'll turn the program over to Aaron Baldwin. Aaron will provide us with an update on the clinic. Aaron, thank you for your leadership and your excellent work that you do for us every day.
Thank you, President Winterstein, and good afternoon, everyone. It's really exciting to be here this afternoon and be able to provide an update on our vaccines, especially as our vaccine activity has really ramped up over the past month. So here on the screen in front of us, we have an update that came off of Iowa's COVID-19 vaccine dashboard just as of this morning. So you can see here, and you can check the status each day, but it was really great to see that a third of Iowans are now fully vaccinated. And the CDC is also reporting that 52% of eligible people in the United States have received at least one shot. So it feels really good to be at this point in time where we went from a lot of challenges around vaccine supply and now be at this place that we're at right now. So I encourage you to watch that data as it continues to move forward. Let's talk about what's new with COVID vaccines here on campus and across the state and country. So the great news is that vaccine is available for all students and employees. And also within the last week too, we worked with the Iowa Department of Public Health and learned that primary or secondary doses can be obtained at different locations. So if we have students that want to be able to get one dose here before they leave for the summer, or if you've gotten a dose somewhere else in the state and want to get your second dose on campus, we have more flexibility now in how we can provide that vaccine, which is great. Also, we were closely watching and monitoring the situation with the Johnson & Johnson vaccine, and as of last Friday, the CDC, FDA, and IDPH did lift the pause in the use of the Johnson & Johnson COVID-19 vaccine. So as of this week, we have started putting that back into use here on campus. Our campus clinics are going really well. From a timeline perspective, we started off with really small clinics the end of December, focused on the IDPH priority groups, and ran those from December through March. And then in April, we started running our larger scale clinics on April 2nd, and we're scheduled right now to run those through May 20th. We're also talking about what clinics would look like at the beginning of the fall semester as students come back to campus, and if they haven't been able to access vaccine where they're at, we'll make sure that folks have access to vaccine on an ongoing basis. We also are really fortunate to be able to partner with Story County Public Health and Iowa Department of Public Health, and we've had access to all three types of the vaccine that are authorized for use in the United States. So we have Pfizer, Moderna, and Johnson & Johnson. The two types that we're using right now, though, are Pfizer and the Johnson & Johnson vaccine. The ISU mass vaccination clinics are happening over at State Gym, and things are going really well there. You see some pictures on the screen. If you haven't been in to get your vaccine there, you can get a taste of what's happening every day at State Gym in our large mass vax clinics. We are running this as an incident command operation, so I want to say a big thank you to our emergency management and Teelan Student Health Center teams for their leadership in the clinics. Our clinic dates that you see on the screen there, we offered on April 15th, 16th, the 20th through the 23rd, and then the 27th through 30th. And then in May, we'll run clinics the 5th through the 7th, the 11th through the 13th, and the 18th through the 20th. And I want to echo President Winterstein's comments and just say a huge thank you to so many of you who have volunteered to help. We've had our non-clinical volunteers that have helped with wayfinding or registration, observation, and our data entry, and then our clinical vaccinators. And we've had not only our great support from the Thielen Student Health Center, our College of Veterinary Medicine, veterinarians and veterinary students, but also our community partners with Story County Public Health and Mary Greeley Medical Center. So appreciate everyone who has helped there. Because of the change in vaccine and the timing of second doses, we will be extending the clinics into the weeks of May 11th and May 18th. So you can stay tuned for sign-up opportunities if you want to be able to help and volunteer at the clinics. And the most exciting news today, I wanted to share some numbers, and these are our campus vaccine clinic results as of April 28th. So as of yesterday, hot off the press. And it's important to remember this is just our vaccine given on campus, and it doesn't include folks that may have gotten vaccine at other locations. So the first chart you see on the top there is the total number of doses that have been given on campus starting in mid-December and through yesterday afternoon. So it's really exciting to see that we've given over 7,105 doses. And you can also see the breakdown by age group on that chart. Our second, that is labeled number by classification, shows the number of people per classification. So if you're a student or an employee, and we also have an other category as Iowa State helped vaccinate some of our campus partners. And this is a unique count of individuals. So each individual in the second chart is only counted once, but it's great to see that over 5,923 people have gotten vaccinated through campus efforts here. So we'll continue to update these information and share that information with campus. Also wanted to just share a couple other quick vaccine-related updates. As always, we're keeping the vaccination page updated, so that's the best place to go for the most current and up-to-date information on vaccines at Iowa State. There are new FAQs. We've got all the vaccine fact sheets so you can read about the different products, the risk factors, and all of the information there. And then there's a new student FAQ dropdown. So I want to say thanks to our strategic communications team for their constant updating and keeping this information fresh for all of us. Also, as you likely saw in a recent campus memo, we are strongly encouraging everybody to get vaccinated, but won't require vaccination at this point in time. But we're really excited to see how many people have been interested and have taken the initiative to get vaccinated, because it certainly supports our efforts to return to a more traditional Iowa State campus experience. And of course, we really want to have all of our students and employees have the opportunities to be in the classroom, attend athletic events, spend time with family and friends, and find their community of people that make Iowa State such a special place to be. So we encourage everyone to vaccinate for Iowa State. Thank you, President Winterstein.
Erin, thank you. And as part of your introduction there, I acknowledged your leadership and the excellent work you do every day. And I know it's a big team, but boy, the Thielen Student Health Center has really delivered for Iowa State University, not only for our students, but also for our faculty and staff as well. So Erin, thank you again. And if we were together, we'd give you all a round of applause, give you and your team a round of applause. Thank you very much. Now we'll bring in Dr. Dan Fulton, infectious disease specialist with McFarland Clinic, and Angie Hunt, director of ISU News Service, for a conversation about COVID vaccines.
Thank you, President Winterstein, and good afternoon, everyone. Dr. Fulton, thank you for joining us again. A lot has sure changed since we last talked back in January for Town Hall. The vaccines are now widely available. As Erin shared, we reached a milestone here in Iowa this week with more than 1 million people who are fully vaccinated. However, we know that there are some people who are maybe still a little hesitant or reluctant. We're seeing more counties decline their vaccine allotments as they're seeing less demand. So I'd like to start today by talking a little bit about conversations that you're having with patients, maybe friends, family, those who particularly are maybe reluctant or hesitant, still deciding. What do you share with them as they're considering and making their decision?
Yeah, that's a great question. You know, I think for me, what's always really important is if we're going to have that conversation, it's important that people know that you care about them, and that's why you're interested in talking about whether they're vaccinated or not. For me, I'm seeing people in clinic, and we're there to talk about their health, so it's a little bit easier of a door to open. But I think starting with the notion that I care about people's health and I want them to be healthy, and I've seen a lot of people get really sick and die from this virus. I've seen a lot of people get sick and then have long-lasting symptoms after having this virus, and wanting to help encourage them to take any means necessary to protect themselves, and then also connect that to how do we protect our community? How do we protect our loved ones around us? So focusing a little bit on the notion that getting a vaccine doesn't just protect you, it potentially protects the people around you as well. People are hesitant about vaccines for a lot of different reasons. And I've actually been sort of pleasantly surprised the number of folks that I thought when we started the conversation that there was just no way we would maybe get anywhere. And then over the course of a conversation focused on caring and kindness, you actually can understand each other, and often people will sort of be more open than you think. I hear a lot of people that are sort of saying they want to wait till there's more information available. And I think what I try to share is just that every day we're getting more information available. And we've now got 150 million folks in the United States vaccinated. And it seems like, generally speaking, these are very safe vaccines, and that we are seeing a dramatic effect in fewer vaccination or fewer infections and fewer folks ending up in the hospital. And we also have real world examples of other countries that have done really massive vaccination campaigns that have really started to move back towards normal in their society and in their communities, where there's little enough virus that people are able to get back to doing the things they love and being with the people they care about. So I try not to get too deep into the weeds about things that I view as maybe a little outlandish or conspiratorial. I don't find that I make a lot of progress in that area. But I think just people know you care about them and know that you want the best for them, and you're willing to engage with them in a respectful way. I think people are more open than you might think.
It's encouraging to hear. And you mentioned the fact that there's a lot of information out there. We're getting new information every day. What do you recommend as far as sources or a place for information people should go if they do have questions?
I would recommend people talk with their doctor if they have questions. I think far and away the most reliable source of information that people have as far as their healthcare is their healthcare providers. In part because their healthcare providers are answering these questions day in and day out, and are quite familiar with the person's specific health conditions, which may inform those decisions. But also they are following this literature more closely because that's kind of their job, and I think are able to give pretty accurate information. I do think that relying on public sources like Iowa Department of Public Health and CDC is really helpful. I think they provide really what I'd call really reliable information. I do think that because of their nature as public institutions, sometimes their formal statements are not quite as quickly put out as maybe the science is starting to indicate. And so people say, well, why haven't they said this yet? And it's just because they're trying to be really thoughtful about not changing the needle from, we recommend this to now we're changing, because if they do it too soon and all of a sudden they got to go back again, that gets really confusing really fast. And so I think they're just trying to be really thoughtful. So that's why I think people's particular physicians and care providers can give them more specific and detailed information. I think it's okay to talk with friends and family about this sort of thing. I would encourage people to talk with friends and family that they have real relationships with, not sort of abstract relationships maybe over social media, because friends and family, I think, are more likely to care about you as a person and what's best for you, and more likely to be pretty real with you about their experience. And there's a variety of other information sources. locally here, we have the Mayo Clinic website, which I think always does a really nice job. And then, you know, our McFarland Clinic and Mary Greeley websites have a lot of vaccine information available too.
As we mentioned, more than 1 million Iowans are now fully vaccinated, which means they've had both doses. And the CDC is reporting that the majority of Americans are fully vaccinated, getting that second dose, but we know that millions are maybe getting the first dose, not the second. And so my next question is kind of two parts. First of all, for those who do get both doses, they're fully vaccinated, how effective is the vaccine?
Yeah, I mean, it's really effective. You know, when we were back in November waiting for this data to come out, I think, you know, the benchmark was if it's over 50% effective, then we'll be, you know, happy about it, and it might be a useful public health tool. When the data came out showing that it was over 90% effective, I think we were all just, you know, blown away and ecstatic about that. I think real world studies beyond, you know, the tightly controlled clinical trials have actually confirmed what the clinical trials said, which is that we can expect vaccine efficacy to be about 90%, even in the real world when people are fully vaccinated. The caveats to that are, you know, in big studies, it's hard to target folks that maybe have underlying immune conditions. And so there remain questions about how effective it might be in that setting. And yet I would say, even in that setting, we are seeing what looks like a very effective vaccine. One question that's come up a lot is, when does it become effective, and when do you kind of consider yourself fully vaccinated? And a big study showed that even after the first vaccine, couple weeks out from there, people are actually seeing close to 70 to 80% protection from infection. And looking at the data, that really is a couple weeks after the first vaccine, where the kind of the curves of the placebo versus the actual vaccine started to separate, was after about 2 weeks. So I think folks that have only gotten one vaccine, I think there's probably pretty good efficacy with that. I think there would be questions about if it would last as long as the folks that got both vaccines. There's some interesting data coming out about folks that have been infected and then gotten a vaccine after that, and it may be that one vaccine in that setting is actually sufficient. But we're still learning about that, and I don't think anybody's quite ready to say don't get the second one yet. I still think there's a pretty firm recommendation that if you get the first one, you should try to get the second one. I also have a pretty low threshold to say if somebody has a pretty significant systemic reaction or kind of an unknown health related thing that happens after the first one, that you should really talk with your doctor before going forward with the second one. It may have been true and unrelated, but you know, as we're trying to be thoughtful and careful, it's worthwhile just checking in and making sure, you know, could that have been related, and do I need to be thoughtful about the second one or not? Definitely people that have like a significant rash reaction or something else, you know, may not be able to take the second one because of that. But even so, I think they have a pretty good degree of protection, you know, into that 70 and 80% realm.
And that touched exactly on the second part of the question I had for you. If people only get one, what that efficacy might be. So kind of branching off from that, if we see more people only getting one dose, I'd like to talk a little bit about herd immunity and how, I guess, what does that mean for herd immunity if folks are only getting, if we see more only getting one dose?
That's a good question. So when we use that term herd immunity, that's sort of saying of the group of us, you know, if a certain amount of us are immune, then those of us that aren't immune are still protected to some degree from catching a virus, because it simply can't move through the community because it hits a lot of locked doors and can't spread from one person to the next. So that is affected by a lot of things. It's affected by how contagious the virus is. And so as some of the variants have come out and seem to be more contagious, then, you know, how many people need to be immune to achieve herd immunity, that number can change over time. In general, it's thought to be around 70%. So if you have a vaccine that's 90% effective, you know, to get the community up to 70%, you know, you don't actually have to vaccinate the whole community. You only need just over 70% of folks. Natural immunity is also a part of this. So folks that have had COVID do seem to be immune and, you know, have some degree of protection for a while. Again, we don't know how long, but so far it seems like it's lasting even from last year. So when people, to answer your question, only get one vaccine, then, you know, if that efficacy drops from 90 down to closer to 70%, then you would kind of need a higher percentage of people to get vaccinated to kind of get to that herd immunity point. Herd immunity doesn't mean that nobody can get infected anymore. It just means that we shouldn't see these kind of exponential explosions of virus in communities where one person infects 4 people, infects 16 people, and on. The whole idea is that one person would maybe infect a half a person, and then those viruses peter out and they don't sort of spread like a wildfire. So that's the goal of herd immunity, is to prevent that kind of exponential growth.
And so it seems when you're talking about that threshold, we really could see varying levels of immunity from one community within our state to the other, or even across the country.
Yeah, well, yeah, I think so. And I think, you know, viruses are local. They have to be spread person to person. So if we as a community can achieve a very high level of immunity through vaccine-generated immunity, especially early on in concordance with, you know, making thoughtful decisions about mask wearing and hand washing and physical distancing. I mean, I think we could see this virus peter out quite a bit faster here locally than even our state or throughout the rest of the country. But I think the other thing that's always true of viruses is that people move, and viruses move with them, and that's true in our state, in our country, and worldwide. And so I think we, you know, are going to reach a point where we need to even start looking beyond our borders towards how do we support the rest of the world towards reaching immunity and avoiding things like what's going on in India right now, you know, which has just been so hard to see.
Going back to what we were talking about just a moment ago with folks maybe not wanting or just failing to remember to follow up and get that second dose, there is a 1-dose option out there. And late last week, the CDC and FDA gave the green light to go ahead and start using the Johnson & Johnson vaccine again. Can you talk a little bit about the risks associated with getting that vaccine for those who may be considering just the 1-dose option?
Yeah, that's a great question. So, you know, all of these vaccines were put through big clinical trials of 50 to 60,000 people. So they're capable of picking up on, you know, a 1 in 60,000 type of side effect. But then you have to keep watching. And once a vaccine goes out to the general population, you wait and you see if there's some signal of a pattern that's coming out. And so what they noticed was after about 6 or 7 million people had received the Johnson & Johnson vaccine, there was a signal of a blood clotting process that seemed to be on the order of around 1 in a million. They had, I think, 5 or 6 cases early on. And with kind of further surveillance during the pause, the reason that they do that pause is to just watch and make sure there's not like a large amount of these things once they've defined it. They found, I think, another 8 or 9 cases, or I think there was 15 cases overall, and a few more may have trickled in now. So it ended up being on the order of about 1 in a million that they were seeing this side effect. And, you know, any sort of unexpected side effect like that is tragic. The other thing was, with blood clots, you usually think about using a specific blood thinner. And in this particular case, the mechanism of the blood clot was such that the typical blood thinner we would use to treat it may have actually made it worse. So now that they've been able to, I think, better define how that process works, I actually think the treatment, should it happen, should that side effect happen, would be easier to start and have it be more successful early on. So I think the CDC and FDA kind of looked at all those things together. They looked at the number of people that are still dying from COVID every day. And they said this 1 in a million side effect is one that is worth taking, basically, when it comes to this vaccine. Well, so that's great from a population standpoint, but then how does that affect individuals, you know? And so I think if we look at the people that actually got blood clots, it seemed like it was primarily young women between the ages of 18 and 50, but the average age has been about 35, which is probably a reflection of the folks that were getting the vaccine at that time too, you know? So I think, you know, the way I think about it is, if I was a person that had a family history of blood clots, had a predisposition to blood clots, was on a medicine that increased the chance of blood clots, the Johnson & Johnson vaccine is one that I would want to think twice about. Again, knowing that it's like for that population, 7 out of 1 million probability, that's still really unlikely. And there are benefits to the Johnson & Johnson, like it's one shot, and a lot of folks have deep needle phobias, and they just cannot imagine doing this more than once. So that's a lot of things for individuals to weigh. So I think it's important people know the data so that they think about the odds. And if you think about other 1 in a million type probabilities in your life, we actually all take a fair number of those types of risks every day, and we tolerate them. So I think leaving it up to individuals to decide still is a reasonable thing to do, as long as we're making sure people have the information to make wise decisions. And you know, if I lived in India right now, I would happily get the Johnson & Johnson myself and, you know, recommend it to everybody, because at that point the risk is so high of not getting it that you know, the benefits far outweigh that. As we get into a lower and lower risk probability here, you know, that's where these kind of questions of 1 in a million become something that people think about. But at this point, I still think it's a really unlikely thing that I think we have a better grip on how to treat if it does happen. Statistically, we would have to vaccinate the entire Iowa State population many, many times before we found one of these cases.
Thank you. You know, as we're talking about second doses, first doses, whatever that may be, at this point for different individuals, we're already hearing from, I believe it was the Pfizer CEO recently came out and said, we're most likely going to need a third dose. So are we learning more about, you know, we talked a moment ago about the effectiveness, but when we may need another dose, and will that vary from each vaccine?
That's a good question. I still say I don't know the answer to that question. I think folks that study these and are particularly interested in the variants are just trying to be aware that different variants have the potential to make our current vaccines less effective. It doesn't mean that they're not effective, but so far the variants that have emerged have just a minimal effect on our current vaccines. They don't seem like they're dramatically decreasing how effective they are, but that is not a promise for the future in terms of you know, preventing future variants from being a problem. There's more. The immune system is hopelessly complex. There has been some hopeful data coming out that shows that even if you've gotten one type of vaccine, more of the memory part of your immune system seems to be able to still respond to other variants. So I lean on that and I feel good about it, but I think if a variant is affecting the efficacy enough, that's where you might see a sort of a booster shot, so to speak, that would help your immune system better target a variant that has a slightly different, you know, way of attaching. So far, when we measure antibody levels, which is again just one part of the immune system, it does seem like even 6 months out from, you know, the studies, those folks that were watching in those studies, they are still maintaining a high level immunity at 6 months. So they're going to keep checking them, and at 12 months we'll hear again, how is their immunity? So that's the other thing, is if for some reason their immunity starts to wane after a month or after a year, you might see some recommendation of saying, you know, maybe we need to give you a booster. On the other hand, I got vaccinated against hepatitis B 30 years ago, and I still have a hepatitis B vaccine or antibody. So, you know, it's possible that our antibodies could last a good long time and keep protecting us. And so that's why it's hard to give you a great answer on that. I think there's there's some notions we may need a booster, and it's good to lay that groundwork conceptually now, but it may turn out we don't.
Like so many things with COVID, there's still a lot that we are learning. Yes. So I just want to give our audience a reminder. I do have a couple more questions for Dr. Fulton, but if you have questions, whether it be for Dr. Fulton or our other campus leaders, you can certainly add those into the Q&A section, and we'll get to as many of those as possible. But just a few other things to chat about before we switch gears. Many parents are working remotely in the community, continuing to still work remotely. And as they're going to start maybe transitioning back or thinking about coming back to work, especially here on campus, what are the risks associated with sending children to childcare or an after school program?
Well, let me start by saying all the folks that are coming back, it's weird and it's hard. But you know, you spend 1 or 2 days back and all of a sudden it's just like, oh, it's actually just kind of normal to be here again. And we encountered that with, you know, every floor in the hospital. When we had our first COVID positive patient on that floor, I would go to the floor and we would meet, and there would be a lot of anxiety until the day started. And then it was like, oh, this is just part of my day, and I do my professional life, and it's okay. And it's kind of amazing how quickly people, you know, what feels like a big ordeal before you do it, really quickly transitions to just, you know, it's just part of your life and it's okay. As far as kids going to school and childcare and activities, you know, I do think that kids can pass viruses around in general. We've all known that forever. I think they can pass COVID around potentially. We have not seen big outbreaks in our schools here in Ames anyway, in part I think because they've been pretty thoughtful about mask wearing. Littler kids, I have not heard much about outbreaks in daycare centers, in part because I think most little kids, they just don't get very sick from this. There are exceptions, you know, kids that have underlying conditions, and kids that are very small, less than 1. But I think in general, people in daycare settings have been really thoughtful about if somebody's sick, they stay home, and, you know, doing everything they can. As we go forward, I wouldn't be surprised if we hear by next month that 12 to 18-year-olds are eligible for vaccination. And I just saw some photos today of, you know, the early trial data, or early trials initiating for even down to little kids with vaccination. So I think, you know, that'll help too, in terms of just that level of protection that we can get out there. So it's kind of a non-answer. I mean, kids can pass viruses around in general. Kids don't seem to get as sick. In general, people are doing what they can to take good protective measures. And reassuringly, I haven't heard about big outbreaks associated with daycare centers at this point. So,
for my final question, the answer may be relatively similar, because if I'm a parent with young children at home or children who are too young to be vaccinated, is there a risk or a concern there? Because even, you know, we don't know, there's still some information we don't know about those who are vaccinated, how they spread. So what might be the risks and concerns there for parents who are vaccinated, but other family members who are not?
Yeah, you know, I think vaccinated people are just dramatically less likely to get infected, which then protects people they're around. I don't think anybody knows for sure if a vaccinated person who never gets sick could actually pass the virus around and not know it, which is a long notion, but it's actually being studied right now. They've initiated a huge trial amongst college kids actually who you know, are in this congregate setting, and they're going to swab all of their noses every day. They're going to have a vaccine group and a non-vaccine group, and they're going to look at their contacts, and they're going to see, are vaccinated people capable of passing virus around? And sort of an anecdote I could tell you is that, you know, our nursing facilities, a lot of folks they've been vaccinated for months, and we had a I guess what would be called an outbreak of COVID in the nursing facility where these folks had been already vaccinated. They'd probably been brought in or something. And so I think 5 or 6 folks got diagnosed. But in the past, where half of those people would end up in the hospital and some of them would not have survived, all those 5 folks only got a sniffle. They didn't pass it on to the rest of the ward, which in the past it would have been like a wildfire through the whole place. And when we tried to sequence virus out of their noses, there was so little virus there, we actually couldn't even do it. So the take home I had from that is that once you're vaccinated, you're just in general less likely to get sick. If you do get sick, you won't get as sick. And if you are sick, you won't have as much virus to spread around. And we'll keep learning more over time. So, you know, I've been going to take care of folks with COVID now for over a year, and get home and I just, you know, gotta hug your kids. You gotta be family. And I just think, you know, do what you can do, be thoughtful. But at the end of the day, I think the risk of bringing COVID home is really low.
Well, thank you, Dr. Fulton. We so appreciate you joining us and answering all my questions and offering some perspective. I'm going to have you stand by. We're going to open it up to Q&A, but we may have a few more questions for you from the audience.
Okay.
But I'm going to shift gears and start with a few questions. The first one here for John Lawrence or Provost Wickert about expectations for the fall for one-on-one appointments. The person writing says they understand the goal is to return to the in-person experience as much as possible, but even with the vaccination, they feel hesitant about meeting with multiple students throughout the day in a small office space, you know, anywhere from a half hour to hour. So what will those expectations be for fall?
Dr. Wickert, would you like to start with that one?
Sure, glad to. Well, first of all, thank you for the question. I definitely understand the question and the concern behind it. You know, as I indicated in my communication to campus last week, our goal, one of our goals for the fall is for student-facing services to be as back to normal as possible for the fall. And of course, we also have a very important goal of following best practices, science-based practices on health and safety. So what I can tell you is that the question you raise is one of the many related questions that we're currently working on through the Moving Forward Committee, as well as through conversations with campus leadership, department chairs, deans, and in collaboration with our faculty senate as well. So I expect that you know, over the coming months, and you know, let's remember we have a couple months you know, until the fall semester starts. We'll be providing guidance over the summer in this area and other areas related to instruction and teaching students, and that will address a variety of questions around office spaces, masks, you know, ventilation, size of meeting spaces, and things like that. So you know, these conversations are underway, and you know, I just encourage you to stay tuned and watch communications that are coming out over the summer.
And he covered it very well. The Moving Forward Committee and others are taking those questions very seriously. We are anticipating making a decision about face coverings you know, later in the summer, around the 1st of August, after we have a better understanding of the you know, vaccinations and how people are reacting and so on.
Thank you, John. And this next question might be a good one for you as well, talking about small meeting spaces and kind of going to the other extreme for guidelines for large events, whether it's external or internal audiences, things like career fairs. Have those guidelines been determined, and when do you expect that information might be available?
Well, again, we are talking about those things now. I know the gatherings and events committee is meeting and having those discussions. We know where we are today, around 50% capacity, much as we are in the classrooms, and we know where we expect to be in August. And so we're looking at what that transition looks like, what are the requirements around masks that go along with that, as well as the capacity that's involved. We expect making those announcements in near future, because we are getting into summer. People are trying to plan, whether it be conferences or weddings or whatever it may be, and we need to get some guidance to those groups. So I expect something soon.
Thank you, John. Our next question is for Christy Dar. With the return to work, are we looking at innovative ways for employees to continue flexible work arrangements as part of the overall innovation plan through campus? While this was originally thought to maybe be temporary, folks are saying they feel it would be beneficial and something that should be considered for our work environment.
Thanks, Angie, and thanks for the question. Certainly, we've heard feedback from staff for many years about the desire to have more flexibility in their work environment, their work times, their work teams approach. And so through the campus climate survey, as well as the Child Care Task Force have contributed. And one of the action items from the Child Care Task Force was for UHR to begin planning, and that was in 2019. And so we want to have a more robust, flexible options for our staff. The COVID and the pandemic put a little wrench into that. And right, we had an experience of all or many, let me correct myself, many being remote fully. And there's an ease of that, but we also know that that's not 100% the flexibility that is possible. And so we continue to work through, again, needing to see a little bit of that post-pandemic, what that might look like in order to align the program. But we're excited about what the fall brings and being able to support our staff as they consider, and the work teams consider what possibilities there are for flexibility.
Great, thank you, Christy. Switching back to our conversation about vaccines, Mike Norton, I'd like to have you help me with this next question. We've heard from the Board of Regents that vaccines will not be mandated for fall. Can you talk a little bit about that decision? And how is it different from other mandatory vaccines, such as the MMR, others that we have required for students?
Thanks, Angie, and good question. There's been a lot of discussion about this. The ability to require or mandate vaccinations is a matter of federal and state law, and then also board policy, as you've mentioned. So federal law is somewhat unclear. Generally speaking, in most cases, vaccinations that have been authorized under emergency use authorization, like what we see here, typically most people have considered those non-mandatory, so that federal law wouldn't allow. But because of the interest in this issue, there's been kind of challenges to that concept, and some have taken the position that even emergency use authorized vaccines can be mandated, and you're seeing some of that across the country with other institutions choosing to mandate vaccines. But as a matter of state law and board policy, we don't have that option here. So even if it were found to be consistent with federal law, there's current legislation passing in the state, or we believe it will pass in the state, that will not allow us to mandate vaccines. And then, of course, as you referenced, the board has also affirmatively stated that they will not let institutions mandate vaccines as well. So I think both as a matter of state law and regent policy, it's unlikely that we'll have the authority to mandate vaccines in the fall.
Thanks, Mike. Aaron Baldwin, a couple questions for you. The first about the symptom checker that we all receive each day. Are there plans for that to be deactivated? And kind of a two-part question, plans for deactivation, and for folks who are fully vaccinated, do they still need to be responding to that?
Yeah, great question, Angie. We are looking at all of these different public health processes as we speak and figuring out what transition plans should look like. I think at some point in time that symptom checker will go away, but we want people to continue using it. I mean, I think it's some really good habits that we've built into our daily routine of thinking about how are we feeling every day, and then making sure if we're not feeling well that we don't go to work when we're sick or go to class when we're sick. So I think it's been a good tool that's hopefully built some good practices, and more to come on when that might stop.
Okay, and another question for you, Aaron. And you kind of touched on the planning for fall, but are there plans to hold additional COVID vaccine clinics in the future, especially if there's the potential for booster shots that may be required, maybe doing something similar to the flu vaccine clinics on campus?
Absolutely. We are absolutely planning on future vaccine clinics for COVID-19 and figuring out how to do that. Specifically, we're looking at setting up some vaccine clinics as our students come back in the fall, depending on where people have had access to vaccine over the summer and if they want access to that. So absolutely ongoing planning for continued vaccine clinics.
Great, thank you, Erin. Mike, another question for you about the vaccine mandate. And while there may not be an overall vaccine mandate, a question about whether students who live in the residence halls, high density housing, potential for students, who want to know the vaccine status of their roommates. Is there anything that can be done there?
Yeah, so again, we'll have to see what the legislation that comes out of the state says about these issues. And there may be a difference between the university mandating disclosure and there being voluntary disclosure at the time, and facilitating that voluntary disclosure. So it's certainly an issue that's on our minds. And, I will say also that we found over the course of COVID that, we did worry about our congregate housing, but come to find out, our residential housing was actually one of the safest places on campus in terms of where people lived. And so I think that's something to keep in mind as well.
Thank you. Dr. Fulton, I have a few questions for you. The first being the fact that there are side effects from the vaccination as we're discovering, but still small number when you look at the total number. But a question about how should someone communicate the concept of risk to friends, family, others that are hesitant to be vaccinated?
That's a good question. I think it would depend on who you're talking to, and you might want to think about things that they enjoy doing, because most things we do have some degree of risk. For example, I go turkey hunting with my dad in the spring, and turkey hunting to me, we do a bow and arrow. It's like the safest thing I can imagine. And yet, in South Dakota this year, a guy was tragically killed while bow hunting for turkeys, and the chance of that happening is like 1 in a million. Like I wouldn't spend any time worrying about that at all. It's tragic. It's very unlikely. But that doesn't mean I'm not going to go turkey hunting anymore, So I think a lot of it depends on connecting with the person you're talking to and understanding that different things have risk and that many times we accept those risks because we're used to them. And also communicating the risk of not doing anything, which is sometimes more risky. So in this case, getting COVID or by not getting vaccinated, the pandemic drags on longer. All of us are still stuck in this kind of pandemic malaise, and so it's all just like delayed. So I think if we can put those risks next to each other, that I think helps people. And I think also helping people see that maybe especially with the Pfizer and Moderna vaccines, I mean, we've given 150 million of these things, and we were able to pick up on a 1 in a million signal with the Johnson & Johnson, and so far there has not been a 1 in a million signal with these other two. I think the question starts to become, well, how long do you want to wait to find out if there's a signal? And there's generally two types of side effects with vaccines. There's early reactions that happen within a couple weeks, and there's these later reactions that, with all other vaccines that we have, they all occur by 8 weeks at the latest. So now we're so far into this campaign, and so many millions of people have been vaccinated. At some point, I think we just need to share the story that it's working and people are tolerating it, and the risks are so low, while still being real about the fact that, like, I felt like I had the flu the next day after my second shot, and it wasn't great. And I went to work, but it wasn't great. And I don't think we should try to sweep under the rug the real side effects that people are having, because that's your immune system turning on and doing its job, and that's what we want. But when we weigh that against the social and medical devastation we've seen over the past 15 months, it's just worth it. It's worth it to move forward and join the community, have the courage to join the community to help everyone. So I don't know. Risk is always hard to communicate, but I think understand the person you're talking to and care about them, and you'll get there.
Another question for you about breakthrough cases of COVID here in Ames. Someone who got both doses and then became infected and symptomatic after. Are we seeing any of those in Ames or Story County?
Pretty rare still. I saw a report of the 150 million some folks that haven't vaccinated. There have been, I think, 7,000 some breakthrough cases, which, if you think about, we know it's 90% effective. That's the quoted data. We kind of expect that. It's not even, it's interesting, but it's not even that remarkable. I have had one person in the hospital that had completed their full series total so far. And that person was unfortunately deeply immunocompromised. So really had a very weak immune system for many reasons. And that person, unlike a year ago when that person I don't think would have survived, that person was in the hospital about 5 days and went home. So, again, we are going to have unlikely and kind of one-off cases of people getting sick, but we're just not seeing huge numbers of people coming in with breakthrough. And when we are, they don't seem like they're getting nearly as sick as they did last year.
A few more here on our list that we'll try to get through, a couple more at least before we hit 2 o'clock. I've heard that if you're vaccinated, you can still pass on the virus. Is that true?
Yes. So vaccine is 90% effective. So there's a chance that if you got exposed, you could still get infected. And then presumably if you're infected, that means there's virus in your nose, you could pass on to somebody else. As overall numbers in the community go down, the chance of you actually getting infected or exposed goes down with it, plus your vaccine protection, plus, as I just said, the amount of virus in a vaccinated person's body and nose seems to be dramatically less than an unvaccinated person. So the chance of passing it on would also be decreased even if you got infected. But we're still waiting for that data about the vaccinated asymptomatic person. What is the chance of being contagious even without symptoms? That's a little bit of a tricky thing to figure out, right? Because like if you're vaccinated and you get exposed, like virus still goes in your nose and it's still there. And so if we swab your nose, we might find a couple viral particles. But when people are actively infected and sick with COVID, you have trillions of viral particles like spewing into the air. So that's a very different contagious circumstance than, you're vaccinated and you have a few particles in your nose that your body is already like chewing through. So we don't perfectly know the answer to that, but I think that people are dramatically less contagious once they've been vaccinated.
And then one more, we know we have the vaccine clinics here on campus, and others may want to weigh on this one too, but how might we know, since people are going to many different locations to be vaccinated, what our vaccination rate is here in the community, whether that be Ames or Story County, and how might that, affect health and safety guidelines for a number of things, such as in-person teaching here on campus? How can we know what's really happening in our community?
That's a good question. From the standpoint of health systems, I think eventually we'll be getting all the data in where we can talk about, within our patient population, we can talk about what % have been vaccinated. We also rely heavily on public health to give us that information. And I imagine survey data through organizations is going to be helpful too. It does seem like, and maybe public health can help me with this a little bit, when people go to like, CVS and get vaccinated there, we don't always have that data within our electronic record here. And there's still some work being done, I think, about how to make those systems talk to each other. But I think we'll get that information as we go forward.
Okay. Well, thank you. And thank you to all of our panelists. We have just about a minute left. So with that, I'm going to turn it back over to President Winterstein.
Well, Angie, thank you so much for serving as our moderator for today's session. Nicely done. I want to thank Erin Baldwin and Dr. Fulton and all of our campus leaders for being here and for sharing important information and answering our questions. This was a repeat performance for Dr. Fulton. Dr. Fulton, we sincerely appreciate your engagement with us. A reminder to all of our participants, if your question was not answered, you can submit it to the covid-19@iastate.edu, and we'll get it directed to the right unit or department for an answer. Please remember that our COVID-19 updates and resources webpage is the central source for the most up-to-date news and information, and we're in the process of updating all that information even as we speak. So bookmark that page and check it often. We'll be posting a recording of today's town hall on that page by the end of the week. To everyone here, please consider getting vaccinated if you haven't already done so. And thank you all for helping us finish the semester strong and setting us up for a successful fall semester. Best wishes, everyone. Thank you.